Dr. Chaitra SK, Consultant Fertility Specialist at Ovum Hospitals, Bangalore. Today I will be speaking about polycystic ovarian syndrome and infertility. So you might have all heard about something called PCOS, PCOD and all. So that is polycystic ovarian syndrome. So how does the patient manifest? So first to tell about the burden of the disease, it affects about 8 to 12% of women in reproductive age, and it is one of the leading causes of infertility as well. So to understand whether a girl is having polycystic ovarian syndrome or not, we have to rely on her symptoms. So first, coming to the symptoms of polycystic ovarian syndrome, the patient will have a very prolonged cycles like irregular ones which might last beyond 40 days. Sometimes she may not get a spontaneous periods at all where they have to take hormonal medications to get periods. Or sometimes the patient will get quite frequent periods with irregular bleeding or excessive bleeding as well. So abnormality in the menstruation is one common symptom how polycystic ovarian patients present to us. The other symptoms might be sudden changes in their weight, that is excessive weight gain. There could be pimple, that is acne, hirsutism, that is excess of hair growth, or sometimes loss of scalp hair also. And the patients will be having glucose intolerance or abnormality in her menstrual cycle. Now when the patient presents to us with this, the first important step is to rule out polycystic ovarian syndrome. Usually we take these symptoms into account and do hormonal profile like AMH, LH, testosterone levels, which usually show elevation in polycystic ovarian patients. And an ultrasound typically shows a polycystic appearance on the ovary. That is, the ovaries will be bulky with more number of eggs inside the ovary, giving it a polycystic appearance. So coming to its infertility burden. So you might have heard a lot of patients talking like they just get scared that polycystic ovary, so definitely the patient is going to suffer from infertility. So a fraction of polycystic ovarian patients do suffer from infertility. And what is the reason for this infertility? That is lack of ovulation. So these patients usually because of excessive testosterone in their body or LH hormones in their body, the pituitary and ovarian axis will have some disturbances, because of which the patient will not be having regular ovulation the way other women have. Because of lack of regular ovulations, these people will end up having infertility. So the treatment of polycystic ovary is very simple. The first main thing is lifestyle modifications. If the patient is having too much of weight gain and all, loss of at least 5% of her body weight helps her in resumption of her regular menstrual cycle. And then a simple ovulation induction helps these patients overcome their infertility issues. So first we will usually overcome other hormonal problems which can cause to infertility. A simple semen analysis of husband to rule out other male infertility causes. So if all other infertility causes are ruled out, it's just a simple ovulation induction to make these patients regularly ovulate on month will help these patients to overcome infertility. So we do get patients telling all we require is regularization of menstruation and not infertility treatment. So it's important to understand that regularization of menstruation, infertility means to make the patient ovulate. So if you ovulate, definitely your periods will also become regular and it will also help you to overcome infertility. The last question is that do all polycystic ovarian patients require IVF treatment? Definitely no. So only a very small fraction of polycystic ovarian patients, especially those with associated factors. They could be having endometriosis or male factor infertility or tubal factor. Only those patients do end up having IVF treatment. So the other common question is that there is something called laparoscopic ovarian drilling. So the moment a patient has a polycystic ovaries, many gynecologists have this tendency of drilling these patients. That is giving a monopolar current to the ovaries, which will help them they give a promises of having regular cycles or overcoming infertility issues post drilling and all. So it's important for the patients to understand that laparoscopic ovarian drilling have specific indications, like who have to undergo laparoscopic ovarian drilling. So suppose if you are having long-standing infertility, you are not able to ovulate even with the help of ovulation induction or use of hormonal injections, or you are having overtly increased hormonal levels, be it testosterone, LH or AMH, then, and especially you also have some associated infertility factors, be it in endometriosis or other issues in the pelvis or tubal factor, then yes, you will be the candidate for laparoscopic ovarian drilling. So instead of just hearing to hearsays, it's better you have a consultation with your fertility expert, understand whether you can overcome your infertility challenges, especially for the one who are having polycystic ovaries, whether a simple ovulation induction or the patient requires a laparoscopic ovarian drilling or IVF would be the treatment of choice. So do visit us to understand more about polycystic ovarian syndrome and infertility. Thank you.